Hello, and welcome to Thoughts on Therapy. I'm Bryan Stevens, a licensed professional counselor with a practice in Marietta, Georgia, and the founder of TalkForward, who's bringing us this podcast today. I've been in active behavioral health for over 25 years, and in that time, I have met all sorts of knowledgeable people. Thoughts on Therapy is the show to bring their knowledge to the general public. Today, we're talking with Griffin Smith about Mentalization Based Treatment, or MBT. Griffin is a licensed clinical social worker that specializes in the treatment of interpersonal distress and dysfunction for adults, adolescents, couples, and families, commonly treating individuals with a history of personality disorder, complex trauma, childhood and adolescent behavioral disorders, as well as mood and anxiety disorders. Griffin has earned his certification in psychoanalytic theory from Emory University Psychoanalytic Institute and receives ongoing training and supervision in MBT through the Gunderson Personality Disorders Institute at the McLean Hospital, affiliated with Harvard Medical School, and the Anna Freud National Center for Children and Families. Griffin founded Totus Intuor Counseling Consulting with the aim of empowering people and maximizing wellness through the relational work. As a clinical practice and organizational consultancy, Totus Intuor specializes in supporting both individuals and organizations within the public and private sectors in clinical and non-clinical capacities. It offers the services of psychotherapy, clinical supervision, and organizational consultation and coaching. All right. Well, I'm happy to have you here today. I've been excited about this. Go ahead. Sorry.
Oh, no. Yeah, no, I was just saying I'm happy to be here as well. Yeah.
Great. So, well, let's jump into it because since you first approached me, the big thing I've wanted to know exactly what is mentalizing?
Yeah, great question, right? That's sort of the $1 million question. Well, I can tell you that without a doubt that mentalizing is not a magic trick, or an illusion, because I don't know. To me, it sounded like kind of a goofy sounding word when I first learned about mentalizing, like it reminded me of something like an illusion or magic trick. But actually, for sort of a foreign word, it actually refers to something that's quite basic, really quite fundamental to being human, to, how our minds work. It's it's a universal or nearly universal mental process of imagining mind, basically, right? Sort of to be a little bit more specific about it, it's the ability to understand actions by others and ourselves through, via mental states, by our internal states of mind. For those that are kind of geeks of developmental psychology, it's kind of like a beefed up theory of mind is kind of a way to think. Yeah.
Okay. So part of it is the idea that I know somebody else has a mind and has some sort of interior thought processes.
Absolutely. Absolutely. Yeah. You're aware that someone else has a mind and you have a mind, and that some awareness that our mind perhaps has something or a lot to do with how we behave, what we can see externally. Yep. Okay. Absolutely. Yeah.
All right. So how does that, kind of come up from a social functioning sort of way? Do you see mentalizing working?
Yeah. So, I think there's probably a lot of debate that's out there, that can be had about the function of mentalizing. For me, I think probably a way to put it is that it's sort of the vehicle for transmitting sociocultural information. It's kind of a way that I like to think of it. Yeah. And, again, there could be a lot of debate as to why it is that we do this mentalizing thing to transmit this kind of social information. I've got, a few thoughts about that, right? Perhaps like, one theory that sort of seems to make some sense for me is a way for us to sort of navigate like complex environments, right? A way for us to sort of ascertain what, or rather like who can we trust and who can't we trust, right? In a pretty quick, in a quick manner, right? Like, especially if we're feeling our survival is at, at a cost, right? Or is being threatened, right? A way
Right.
for us to kind of do this sort of thing. Yeah.
Okay. So it sounds like then maybe one of the things we're able to do with mentalizing is have some understanding of, we talk about trust, right?
Hmm.
I may, based upon how somebody else is, think, okay, well, can I trust them or not? What do I think that they're thinking, right? So
Right.
some
Right.
trust is, this person can think, they know there'll be consequences if they, for instance, breach the contract.
Right. 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 Exactly. Exactly. Yeah. Um, yeah. So yeah, I mean, and trust, listen, I mean, the trust, I think really is this, this is such a delicate thing. It's such a fragile thing. I mean, it's, as I imagine, right?
Right.
You would think as well, right? As a therapist, right? Just how fragile this sort of thing is. And it's always striking to me that we sort of do this whole thing of like, looking at someone's actions and then sort of formulating in our minds, okay, well, maybe this is going on, or maybe that is going on, as a way to sort of ascertain, well, like, this makes sense or that makes sense, or I could
Hmm.
trust this or I can't trust
Right.
that. Right. But I think what's interesting to me too is that, that would sort of be indicative of like good mentalizing, right? To really be
Right.
expansive in how we're thinking about what's going on internally for someone, like what they're feeling, what they're thinking, putting together a lot of sort of context to sort of paint a picture. That would be
Right.
indicative of good mentalizing. But the thing that always kind of strikes me and that I encounter a lot in my work is that, we really, especially now, it seems, we really don't do this all too well, or much at all, right? Instead, we sort of focus on, the externals. We focus on actions, in of themselves without context of like imagining what's
Right.
going on behind them, or we focus on the outcomes of things, where we're focusing on sort of elaborate narratives that we all, certain groups share, right? That we sort of just focus on this like doctored up narrative, and don't really sort of examine it,
Right.
more.
So, yeah,
Okay.
I wonder about like, so I think about mentalizing. What comes to mind, we're talking about this is driving.
Yeah, yeah, yeah.
And so driving creates this weird second order effect where um, it's almost not even another human being. It's a car, right?
Mm.
So there's a depersonalization, but somebody cuts me off. It's, and I don't know if this would be considered poor or mentalizing or maybe incorrect mentalizing,
Mhm.
but it's easy, or at least for me, I don't know how it is for other people, but it's easy for me to think, well, they did that on purpose, right?
Mm,
That
mhm.
person saw me here and, with malice aforethought, was like, oh, I'm going to go cut this other guy off.
Right.
And so I can get upset because I've ascribed this hostile mental state to the person,
Right.
right?
Right.
And then I get angry. Whereas if I can ascribe a oblivious mental state to
Sure.
the person, I'm much less likely to get angry about it.
Yeah, no, absolutely. Absolutely. I love that example too. I mean, we both live in the Atlanta area. And if anyone's been to Atlanta, traffic is, this is this is a common experience for Atlanta
Right.
drivers here, right? This being dangerously cut off or being in a dangerous driving situation. But yeah, yeah, absolutely. Yeah, we have a lot of automation to our thinking and our, there's a lot of automation to our thinking and our feelings and our behaviors happens in a split second. We don't necessarily even kind of recognize, right? We kind of just pace on through life. We go moment to moment without necessarily considering, again, how much automation there is
Mhm.
to what we do, how automatic things are. And that's a great example, right? Being cut off, you know, that jerk over here, what he's, this guy's trying to kill me, right?
Right.
Great example.
Yeah. Well, as I've noticed, and I've said this to clients, human beings, because we're able to predict the future and we're able to make these sorts of decisions, are able to make existential threats out of all sorts of things. that in fact are not existential threats, but we
Right.
make them that way, and then our minds and bodies respond. So, as we talk about that, Griffin, one of the things that I've always said about mental health is, the kind of the therapy work is a lot of what we do is we make the unconscious conscious.
Right.
And so, it kind of sounds like part of what we're talking about here is we're doing this mentalizing all the time, but we're not always aware of it. So I guess my question would be, what have you seen kind of a quality of somebody's mentalization and how it affects their mental health? I mean, how do you see that expressed in people?
Yeah, no, it's a great question. I kind of think of mentalizing, for me, the way I sort of think of it, it's almost like it's sort of like a tuning fork to reality, a little bit. Social reality, let's call, say it's like a sort of tuning fork to social reality. And so for mentalizing, by the way, a lot of the concepts behind it relate to a lot of other kind of theories of development and theory of mind. For instance, attachment theory is one major influence of mentalizing, and sort of, in a lot of ways, actually kind of think of mentalizing as almost, you can almost, at least for me, I think of it almost as like a process that underlies an attachment process, right? It's sort of like gives more specificity to what happens interpersonally that we sort of ascribe in an attachment process, right? When we look at attachment styles and sort of the development of internal working models and stuff like that. But yeah, I mean, it's important to our mental health. And again, if we're thinking it from an attachment perspective, right? When we think of attachment, right, we think of processes like mirroring, right, or processes of attunement that are important to developing a secure sense of self and a secure and safe sense with others, right? That's what I mean about the tuning fork of kind of social reality, right? It's that there's a lot of research, and sort of ideas at this point that sort of support this notion that that we need to be seen in a particular way, attuned to, right? Mirrored what's happening with us internally, right? We need an outside force. We need something external to us to sort of help us make sense of that, right? To help us make sense of, what is this experience that I'm feeling inside? And is it something that has bearing out there in the world that I live in? Does it have a bearing there? And so that's kind of what I mean. With mentalizing, it's very much about what's the internal that's happening for someone. So, promoting that kind of that sort of attunement that we all can benefit from, right?
Okay. So if I'm understanding it, part of what's going on is I know I've got my own internal thought processes and my own feelings and things that go with it. So part of the social dynamic is, I could get this from parents, I could get this from friends, but here's how I'm feeling, and somebody else can normalize that and say, yes, there's something universal about your experience. You've got an individual experience, but there's something universal about it as well, where I'm going to help you make sense of what you're feeling and sense of what you're thinking.
Right. And I think especially the latter part of what you were saying, not necessarily that it's so universal or it's like normalized, like, this is something that everybody experiences, but especially that latter part of like, well, I'm seeing, or I think I'm seeing what you're experiencing inside, right? I think I have an understanding what you're experiencing, giving feedback to that to help them make sense of that, right? To give that, if that makes sense.
Yeah. Well, it's my Jungian leanings that want to make people's experiences universal, both universal and individual. So, hopefully with your Freudian training, we can still get along for the rest of the.
We could. If we did another talk, we could go on for hours about psychoanalysis, because there's a lot I can say about Freud, and not necessarily so much in the positive. Although he did some fantastic things, but just like anyone, there's a lot to
it's a mix.
Well,
it's a mixed bag. I will say, I think a lot of what he got right, we just take for granted these days. So what's left in kind of the public zeitgeist is the remainder. But there's a lot of things he got right and got us pointed in the right direction.
Oh, absolutely. Yeah.
So what, I guess then kind of my question becomes, what are some ways that you see like mentalizing kind of go sideways or go awry as we're going through this process?
Yeah. So, as I mentioned, if we're thinking about mentalizing sort of hinging around trust, right? That's sort of where this whole thing kind of goes awry, right? First, in whether or not this mirroring process occurs or doesn't occur, right? To the extent one is attuned to or not attuned to has everything to do with our trust, right? Our trust in that person, that trust in that experience, right? Essentially, to put it another way, right? When someone is giving us like a sort of marked mirroring, what happens inside is we feel a sense of like continuity between our internal and external states, right? We feel connected, right? Connected inside, internally, externally, that sort of thing. But when that's a miss in a way, right? Let's say someone, and that can be a miss in so many different ways, like let's say we're feeling dismissed, or we're feeling, ignored, or we're feeling used or manipulated, or,
Right.
or something, something that's just like, a miss from our internal experience. It creates this experience that, well, in the mentalizing world, we refer to this as the alien self, right? Basically, it's this, it's an experience of like discontinuity and disconnection internally and externally, right? And so it just doesn't sit well with us. It doesn't sort of comport with what we feel inside. And so what happens is that, that has a direct effect on the trust, on our trust in that moment, right? We don't trust that external thing or that experience when it leaves us with these sort of discontinuity, right?
Well, that sounds like you're describing adolescence.
I mean, certainly, yeah. I mean, in a lot of ways, yeah, it's, prominent time for that sort of thing. Sure. Yeah.
Because maybe the structures and things that I had put together previously may not make the sense anymore that they used to.
Right.
And I have more sense of incongruence or discontinuity.
Right. Yeah. I mean, there's a lot of ways in which that sort of we can get feedback and an input from our circumstances that makes us feel a discontinuity, and so then what, that tends to lead this to some sort of like damage to our mentalizing, right? We sort of close it off or shut it down in some kind of way, right? Very often is the result of that experience of the alien self, that experience of discontinuity, right? Okay. Mistrust sort of takes presence, right?
Okay.
Rather than leaning in, we back off and we sort of close off, right?
So what is this? So I'm not doing all the mentalizing, or I'm in more of a non-mentalizing mode. So what is that? How does that express? What does that look like or feel kind of internally and externally for people?
Yeah. So if we're thinking of mentalizing as a continuum, right, of like, poor to good, right? Poor to quality. It can actually be so poor that it's essentially not functioning at all, right? Which we refer to as non-mentalizing. It's when mentalizing becomes blocked in a way, right? And that sort of comes from interpersonal distress. When we're distressed and we're feeling a lot of an emotional arousal, we shut down our mentalizing. There's sort of a direct correlation between our are mentalizing the quality in which we're doing it and how much we're doing it, right? How much we're sort of imagining or sort of being curious or wondering about the other person, their mind state, and our own mental state, in accordance with our emotional arousal. So when that's really heightened, in an interpersonal context, it sort of shuts down. But I think a more specific way to kind of think of that, like a more specific way to kind of describe that is some part of our mentalizing gets turned all the way up, and then all the others sort of gets turned all the way down, right? We can actually think of our mentalizing kind of like the EQ settings on a stereo, right? Where you've got, different dimensions to the sound quality, volume, bass, treble, so on and so forth. We have dimensions of our mentalizing that we think of in a similar way. Not to go into all that, but for instance, like self versus other, automatic versus controlled, internal versus external, cognitive versus affective. So I just went through all the dimensions there, right? There's 4 of them. But those are like EQ settings. So in a way, when someone's not mentalizing, one of those settings sort of gets ramped all the way up, right? In a way, like, let's say affective and the cognitive, like kind of balance, that seesaw that we're always on of like feeling experience and thinking experience, with emotional arousal, like we may go all the way affective, and no longer is that cognitive sort of operating in some kind of way, or the opposite, right? So one last point to this non-mentalizing thing is that's kind of interesting, is that it breaks down into a few different modes. There's a few different let's say categories of non-mentalizing, which we refer to as modes. So there's psychic equivalence mode, pretend mode, and teleological mode, right? But we can kind of talk a little bit about what those are, but these all sort of comport with a different, if we're thinking that EQ setting, in one way or another, these like sort of knobs being turned all the way over, or another. Yeah.
Okay. So I wonder if maybe what we could talk about then a little bit is some kind of, real world living examples of what happens when I've got some of my mentalizing dials are turned the wrong way. I mean, I certainly can see, you talk about the kind of getting into the emotional mode. I look at that as, well, I'm up into my limbic system and I'm not using my prefrontal cortex anymore. And I'm certainly no longer thinking about what's going on in somebody else's head. I'm just worried about my feelings. So maybe I have no idea if that fits into the dials, but what are some examples? Yeah.
Yeah, no, I mean, it's a great example, and again, I think there's a lot of different ways that people sort of coin this sort of phenomenon, right? That's a very neuroscientific way of putting it, right? Our limbic system versus our frontal cortex, sort of operating,
right?
Or something like, if you're familiar, like, we're using reptile brain or reptilian brain. Sometimes, I've heard things kind of described in that way. So there's a lot of different ways of kind of coining this, but yeah, I mean, there's countless examples of this sort of thing, right? I mean, you can think of this on a individual level, like, think of anytime you become angry with someone, right? The more angry you become, the less sort of interested we tend to become of like, or concerned with, or interested of like, what's happening with them, what's going on in their minds. It's sort of like what you said earlier with the traffic analogy, right? The traffic metaphor. We become very convinced, right, that their intentions were one way, that their motives were one way, that they, and so it gets very narrow, right? But I think, again, we see this, we sort of see this play out in larger contexts too. I mean, I would say when you look at, for instance, the kind of political division you see these days, all the, sort of referred to as like sort of tribalism and things of that nature. I feel like in a lot of ways you can sort of think of that, you can frame that from a mentalizing perspective, right? Of, falling into a sort of non-mentalized way of being, right? We're not, when you get sucked into that echo chamber, you're sucked into that sort of, recycled space, right? It's, we, we lose a lot of, we lose a lot of interest and sort of perspective of like what compels someone, to sort of have this sort of value, right? Or believe this particular thing, or
I don't, yeah, so I don't care why you vote the way you do. You must do it because you're a bad person.
right.
Or
Sure.
you do it because you're
You
stupid.
must be whatever. Yeah. Fill in the blanks, racist, or, you want, you want the government to sort of take over our life, whatever, fill in the blank. But absolutely. Yeah. We let certain things sort of dominate our mental experience, right? It takes over everything. Going back to that non-mentalized mode, by the way, right? Like, this is where it gets really interesting when you kind of dig into some of the nuances of what those are. So pretend mode, for instance, is that's a non-mentalized state of being where we're essentially, it's very cognitively driven, not very effectively driven, right? Where we kind of doctor up a reality in a very intellectualized or cognitive way that doesn't really have much basis to really what's going on, right? It doesn't have much basis to it's a lot of like hypothecating and a lot of spinning our wheels, as it were, right? You can see a lot of that, going on. For instance, virtue signaling might be a good example of a kind of pretend mode where you intellectually understand a certain concept or a certain, like, let's say, a value that you want to sort of identify with,
Right.
you want to be associated to, and so you communicate that, you express that in some kind of way, putting up a banner or advocating in some kind of way. But if you really were to ask that person or kind of dig in, I'm not saying this is across the board, right? Only in an example of its true virtue signaling. If you were really to dig in and sort of ask that person about that issue or that thing, you find there's not much substance behind it, not much meat, not much
I've run into that with another therapist once told me. He says, generally when people are asking a question, they're not really asking for information. So if I ask you whether or not it's raining, you probably want to know whether it's raining. But if you ask me who I voted for, you're probably looking for validation or congruence, that sense of congruence, based upon who you voted for.
Right.
That's what most people are seeking, except for the handful of people that are conflict seeking. They're hoping for an argument. So I've literally found I tend to be intellectual and I tend to think a lot about stuff. And if I hold a position, I can tell you why in great detail. And I've run into that very problem where somebody's asked me a question and I don't give the right answer and they start arguing with me, and I'm think, oh, good, a debate, because I'm part of the minority of people that are conflict seeking, verbally anyway. And, this poor person was simply trying to, I guess, feel good, right? Have put some sort of cap on things. Right. And I'm busy, taking apart their position because I've thought about it more.
Absolutely.
Not because I'm right necessarily. I like to debate and I've got more arguments to bring to bear. Right.
Yeah, I love that example, Bryan. I'm with you too. I'm very much, when I fall into non-mentalizing, it's very often some intellectualized sort of perspective. I turn my knob all the way to cognitive, right? Yeah. But I think your example is such a great one. It's a perfect example of like a mentalizing miss, right? Of your mentalizing sort of not operating at its fullest in that moment, poorly in a way, right? Essentially, you assumed that person was sort of looking for their intention was one way, right? And you may have been wrong, right? Their intention might have been something totally different. Their intention, in fact, was to, have a kind of moment of unity with you, right? What's interesting too is like kind of looking at how their mentalizing was operating. They also made a bold assumption about your intentions, right? Your intentions essentially were different. You read it as oh, maybe they want a good debate, a healthy debate here, right? No, they actually wanted to feel a sense of like connection with you.
Right. I picked the wrong, and I picked the wrong dial. And because I now deal that with people ask me those sorts of questions, I say, I haven't really thought about it, which if they know me ought to be like, really? But it avoids the potential conflict.
Right.
Because I don't think I get very far saying, well, I know what you're really seeking is unity, but part of it is for me is trying to going back to it is taking my automatic response and think about what that is, be aware of what that is, be aware that, and now let me invoke somebody else, Adler, I have an old strategy that I try to avoid, but it's a competitive strategy nonetheless, to be the smartest guy in the room.
Right. Sure.
And now if we've got some emotional energy going on, well, now I've got some sort of sense of competition. I don't want to feel inferior. Oh, let me pull out that smartest guy in the room strategy.
Right.
And
it's complex. Yeah.
And I got to say, though, the smartest guy in the room strategy doesn't win friends or influence people. That's for it's not the way to do it.
Right. Yeah. Right.
So that makes I like that. It makes a lot of sense that there you've got both people in that moment misunderstanding what's going on in the other person's head.
Right.
And maybe not even fully understanding what's going on in their head. Right. So it took me a while to figure out that, in fact, what I was doing was now I'm playing this competitive game where I need to win.
Right.
Because then now I feel congruent because I've had a victory.
Right.
When the reality is I like connecting to other people. So if I can somehow take them up on their offer to have some sort of connection, even if I don't agree with them on this particular topic, maybe I can find something else and do that mindfully, or use my mentalizing so that my knobs are in balance, to as you get a much better outcome. So
no, absolutely yeah. And I love what you were saying about how sometimes they may not even be aware of what they want. I'm going to say we're not, because we all can get there, right? We aren't always aware of what we're really feeling, what we're thinking, and that intricate tapestry that is our mind, right? Of how that's all working and really what we're experiencing, which is another hallmark of poor mentalizing, right? Is not only losing a sense and losing interest in someone else's mind, right? But ourselves, because for mentalizing, much like attachment, our sense of self is intrinsically connected to the other, others, right? It's the process is bi-directional always, right? Yeah, absolutely.
So what can we do to improve it, right? What are some ways we can do it? Because obviously I think we got some examples for that, and potential road rage. It's kind of funny. I had a trucker I knew once said, so how do you do a road rage? So it's very simple. I just assume that everybody has just heard that a loved one has died and they're not at their best. Boy, it's really hard to get mad at that person for cutting me off.
Right.
So I thought, well, that's a good, I'm like, well, that's a good cognitive restructuring. It's like, what are you talking about? I said, it's therapist talk, but So what are some of those things that we can do like that to help us improve our quality of our mentalizing?
Sure. Well, actually, you in a lot of ways in that example you gave, Bryan, that actually exemplified kind of a direction that really helps promote good mentalizing. Like essentially what you did there, or what I imagine and kind of you did there, is that you suspended your assumptions, right? You suspended, your assumptions that expanded upon possibility in your mind, right? You said to yourself, or you imagined to yourself that they had this really horrible day or this horrible thing sort of happened to sort of as a way to, as you said, cognitively restructure how you were going into that experience. There's three like kind of really core principles to good mentalizing, right? A really quality mentalized stance. There's three kind of core principles to it. One is curiosity.
Okay.
So there's curiosity. Then there's what we refer to as the not knowing stance or uncertainty, which kind of gets at to what I'll return to that kind of in your example there. And then the third's authenticity or genuineness. Okay. So the not knowing stance is key. The embracing uncertainty is key to improving our mentalizing, right? It's sort of reckoning with in acknowledging that there may be more than what we know, right? There may be more than how we're seeing this. There could be alternatives here. There could be a different way than how I'm seeing this. And that goes back to your example of, well, imagining that they had the worst day. It would be something like that, but perhaps not being so specific and just imagining that's 100% what happened, but sort of saying, coming from a position of, I have no idea what led them to do what they did or say what they did, or what led them to ultimately, I'm coming in completely neutral and with a black box, totally, right? But rather than and this is where the curiosity part comes in, rather than sort of pushing that aside and saying, well, I don't know anything, right? I mean, I can't imagine. It could be a number of possibilities. It doesn't really interest me to find out because, it could be almost anything, right?
Right.
Rather than doing that, you step into the unknown. You step into that black box. From the curious position, you're inquisitive about that. Well, I don't know, but maybe I can find out more. And so let me ask questions. Let me kind of investigate that. Let me ask, let me sort of find out. And then the third part goes with authenticity is, that we're doing that in a way that's not, again, that's in a way that's genuine, there's a way that's authentic. We're not, we're doing that in a way where we feel we're allowing what we're really feeling and what we're really thinking to kind of come through, right? That doesn't necessarily mean, being aggressive if we're feeling like frustrated or being, condescending or something like that, but reckoning with what we're feeling and what we're thinking and sort of allowing that to be expressed unfiltered in a way, right? Through how we're questioning, how we're coming into this unknown space, if that makes sense, right? Yeah.
Well, I think as I read this in a book once, that it was with a husband and wife were fighting, and somebody intervened and said, "You both love each other. Why don't you start with the decisions that both of you made were around the fact that you love the other person and you weren't trying to hurt them? Now have the discussion about what you're talking about, but why don't you assume that there was no ill intent on either person's side,
Right. Yeah, and, absolutely.
And it's like, why don't we start there? And just as you were talking, I kept thinking about what, I've told many people about communicating with their spouses, which is, strike while the iron is cold. Have these conversations when the limbic system is not running on full. And of course, as we, it's cliched, but it works. Use I statements. This is how I respond. Don't use always and never, because those are kind of that pretend you're talking about. Always and never are fairy tales. Those are words
that
for
black and white thinking, right? Yeah.
I've said that to clients. Always and never you see in fairy tales and no place else. So
Yeah.
In
Yeah.
real life, we don't have them. So I kind of lead. So I had another question, but you've kind of partially answered it already, I think. But let's say I'm doing a pretty good job mentalizing, right? I'm
Uh-huh.
practicing
Right.
skills. I'm doing a pretty good job, but I
Right.
have, say, a friend or a significant other or somebody who really is struggling with their mentalizations, and that I think could make them difficult to communicate with, or I might find them to be tedious. So
Mhm.
what are some ways that I can kind of use my own mentalizing to help me bridge that with them?
Yeah, no, that's a great question. Um, Going back to the three pillars, as it were, of that mentalizing stance, the curiosity, uncertainty, and
Right.
authenticity. Kind of always, that's always your guidepost. That's always going to be, the guiding light that you're sort of on. So that may be, so when we're doing that, by the way, right, we suspend we're getting into a practice of suspending our assumptions, as you're pointing out, earlier about your work with clients and stuff like that. We're getting into a practice of suspending our assumption
Mm-hmm.
and broadening our perspective, right? And sort of, you know, there was an interview you did recently. I think it was with Cynthia Schwartzberg, and
Mm-hmm.
I can't remember the name of her, but it was like Curious Voyage or something like that. And I love that because it kind of makes me think a lot of this this maneuver through that we're doing, right?
Right.
We're taking a curious sort of unknown voyage into that person's mind and into our own minds, right? So the first thing is to, if you really are mentalizing well, right, you would be, first of all, interested to find out more, and you would be acknowledging that there's likely a lot that you're not getting here, or that you're
Right.
maybe assuming. And you start by, sort of asking questions, or you might start by asking questions about, well, what is it what is it that you're feeling? What is it exactly that prompted you to say what you said right there? Or
Right.
what is it that, that's telling you this, right? Now, if you're encountering someone that's difficult, right, it's at least in my experience, right, is what makes someone difficult a lot of the times is, oftentimes has to do with a lot of like emotional arousal that occurs for them, right? They get emotionally dysregulated. And when that happens, sort of act and, automatically upon that
Right.
dysregulation, and it gets, the mentalizing gets lost and that sort of thing. So if that's happening, right, let's say you're encountering someone that's very emotionally heightened, as it were, right? Asking questions, they're not, as you said earlier about like striking when the iron is cold. I love that,
Yeah.
right? It's important. It's going to be important to, as I agree with that, to bring the levels down, bring the heat down, right? And so a mentalizing way of doing that is starting with an empathic sort of stance, and rather than asking questions and trying to learn more and trying to help them sort of make connections between their experiences, their internal experiences and their actions, first first doing it in just a more empathic and kind of supportive way, right? Of however you can, right? Like, well, I can, I'm getting like you said, using I statements, I'm getting the sense that, you're maybe upset right now, you're upset at something that maybe I said, I don't know,
Right.
and that's that not knowing, right? You help them sort of
Right.
elaborate.
I think especially in those situations, trying to be that empathy, and it makes sense now, it clicks, because so often when somebody's emotionally dysregulated,
Mm-hmm. Mm-hmm.
what we try to do is some variation of the command, calm down,
Right. Right.
which is pouring gasoline on the fire.
Yep.
Because
Yep.
none of us, when we're emotionally dysregulated, want to have somebody else tell us,
Right.
calm down, it's not that big a deal. It's all some variation of, you shouldn't be this emotionally dysregulated. You shouldn't feel
Right.
this way,
Right.
which is about as um, kind of thinking about this terminology is about as incongruent as it can possibly be. I feel the way I feel.
Yep. Absolutely.
And
Yep.
I'm not in control of it. It's got me in its grips. And you're telling me it's not there's no value to it, or you're telling me it's not real somehow. And that creates an intensification. So I love this because it's a good way of thinking about, that's reminding myself that's where that person is right now. And yeah, I know what it feels like. We all know what it feels like to be that way. Right. That's where they are. I can't let that and that state's genuinely uncomfortable, and we don't want to even have any empathy for it. I don't want to feel like other people being upset make us upset, but that's where they are. Let me validate it. Here's where we're at. You're upset. I understand. I'm here with you.
That's absolutely on the money. Again, from a mentalizing frame, that puts it very well in terms of the thinking and the approach, right? Is going back to what we were talking about earlier about the alien self and that incongruence of like not being mirrored, not being attuned to. Sure, when someone says to you, in some form, just calm down, nothing about that feels like we're being, understood or attuned to, right? So yeah, that's why, the first and most basic move, right, of helping someone get into a more mentalized space in a more a space of better communication and better sort of relation is always starts with empathy. It starts with that validation, the empathic validation, as we call it in mentalizing sort of parlance. Empathizing their position, validating that. And that helps kind of cool the engines a bit, right? As you helps them feel more safe, more secure, more entrusting of you, right? It brings the trust into the picture. And once that sort of has stabilized, once there's a sense of trust that's been instilled, and rapport, then we can start exploring from there slowly outward by sort of asking these questions like, well, help me understand more of your mind that I'm still not understanding. Help me get there. Where how did you get from this point to that point to this point, right? As you see it. I really, because I'm interested about it.
Well,
I want to learn about it. Right?
And of course, then they may not know at all.
Right.
Which is interesting. And I think the other way around, the person who's got they're like a knob turned all the way to cognition. Often with let's put this, the nice thing about being I've got my knob turned to feelings is at least I know what my feelings are.
Right. Yeah.
Right. You can't ask that person what were you thinking because they don't know.
Yeah, sure.
But the person who's the Sheldon Cooper who's got their knob turned all the way the other way, what are you feeling? I don't know what I'm feeling. Something. Probably anxiety, because that's the only feeling I've got. And so, now I've got a mentalizing that's totally cognitive. And it's like, okay, well, let's try to help you understand how you're feeling about things. It amazes me how much high cognition people will retreat into this, well, I'm logical, and get so frustrated with other people because they perceive other people as illogical.
Right.
And I'm like, but you don't drive the minimal possible car that you can get away with.
Right.
You don't live in a box.
Yeah.
Right. So how you feel about things is actually important. But they're unable to, that not only can they not kind of mentalize that how people feel about things is important in other people's heads.
Right.
They don't understand it's important in themselves, and they belittle it. Right. They devalue it. And so I really can kind of see, well, part of this mentalization is let's look at how some of this stuff is in fact value in the process of making decisions. Right.
Yeah, it very much is. It's a way to put it, the way I sort of, is described. It's two people, sometimes more than two people, but two people bringing their joint attention to the mind
Right.
of someone else, right? We're bringing our joint attention to you in this case. What's happening for you? You know, in using your words, your experiences, the best you can describe it. And you're right. You're absolutely right. I mean, I certainly encounter that all the time. I imagine as you do in your work of, you know, people saying, well, I don't know what I was feeling or what I was thinking per se, you know, and they're lost. Which is why I love that the expression of meeting someone with where they're at, right? Is such a beautiful and just powerful force, right? Then it sort of becomes incumbent upon us as the listener or the therapist, you know, to do our best to sort of really put our own ability to sort of attune to the test, right? Of like, well, this is my sense of where you're at, right? And so if you can't say this, what can you say, right? Like, let's rewind the clock. Okay, so, okay, I get that we're not understanding now, but can we rewind to a point where you were clear about something? And where exactly, we're going to kind of microslice and go through moment to moment. Where exactly did you start to lose it, right? Sometimes it can be easier for them to retrieve it when we kind of deliberately and diligently kind of go through, right? That way, yeah.
Well, so what are some, I guess kind of the final thing would then be, because obviously we can get some help from family members and whatnot, but sometimes we do need to see a professional. So what are some therapies that, you know, you see as really focusing on mentalizing?
Yeah. So what's interesting about this really is that it's, you know, it's been said, and I see this too. I mean, I've had training in several different therapies. Obviously, there's a lot that I don't, but I think in some form or another, all therapies, right? Any talk therapy really on some level uses mentalizing interventions, right? If there's ever a case where you as the therapist are interested in the mind of your client or your patient, or, you know, that who's sitting across from you, you know, we're doing mentalizing type of work, right? You know, of course, my training is in MBT, mentalization based therapy. So with that form of therapy, it really brings mentalizing front and center. So if all therapies kind of use mentalizing interventions in some form or another, MBT takes it and puts it really, you know, hones a spotlight on it, right? And really just brings that to the forefront. You know, it becomes something that all of the work sort of hinges around what's happening in that the mentalized frame. Is that person mentalizing? Are they not? How are they mentalizing? You know, what's the balance of their EQ? How am I mentalizing? Where am I sort of finding myself getting lost or getting confused or feeling frustrated? And, you know, what's up with that, right? So there's, you know, mentalizing as being a relational therapy, it naturally brings in that transferential space, right? The transference and countertransference kind of, it's another way to kind of like frame that sort of experience of in the room and, you know, what's happening between two people, right?
I do like anytime I can give my clients some vocabulary to help them understand and explain what's going on for them. I found that to be pretty powerful. Doesn't really matter exactly what the vocabulary is, but giving them some labels and being able to use kind of that part of their brain to help understand what's going on, I think can be very powerful. So I like the idea of some of this MBT tools, and we can talk about the different scales with a client, and, you know, then they can come in and say, well, I had my cognition button turned all the way to the right, and you know, this happened, or you know, Chris, I like to use a lot of metaphor with my clients, and that, again, that's probably my Jungian leanings, but you know, I find I use different metaphors for different clients. So if I've got the highly educated medical person, or, you know, more scientifically minded person, I might talk a lot more about biology and neuroscience.
Yeah.
And if I've got somebody who's more, you know, kind of less cognitive and more feeling, we definitely, then I'm a lot more likely to talk and give them more of a feelings vocabulary to talk about. And
Absolutely.
yeah.
Yeah.
So kind of meeting them where they're at, as you say.
Exactly. Yeah. I was going to say the exact same thing, meeting them where they're at, right? The ultimate aim of mentalizing, I'll say this, just as an important piece of it, it's about getting into a we space, a joined space, right? Kind of like you and I were thinking about the same thing right then, right? It sounds like
Right.
Meeting someone where they're at. That's what we're trying to get to always, right? With MBT, in a really a quality mentalized space. It's about joining with that person and finding a shared language, finding a shared, a shared kind of common ground of experience if possible, right? Even if we don't have a direct experience that we share with them, being able to join up and have the sense that we're both in that space and we both understand, that's why I love what you were saying about, teaching them to recognizing themselves when their EQ setting, their knobs are kind of turned one way or the other. That's absolutely part of the MBT process of like giving them that facility, right?
Right.
Equipping that person with that. Yeah.
Well, I love it. Well, I imagine we probably could go on for another 3 hours talking about this, but so I definitely, this has been a great conversation. I definitely appreciate you being here today to talk to me about mentalization.
Yeah, me as well. I've really enjoyed it, Brian. I love what you're doing here. This web series, it's fantastic. I'm a fan.
Well, good. Well,
Yeah,
I love that.
Well, I hope
Well,
this continue.
okay, well, good. Yeah. So and I'll say to the viewers, if you are a fan, I'm going to ask you to do the standard YouTube thing. So please like, subscribe, share with other people that you think might be interested in this content. And Griffin will make sure to have your contact information down in the program description. And again, thank you for coming on Thoughts on Therapy.
Thank you so much. Thanks, Brian.